Planning for retirement isn't just something that individuals need to do. When a cohort the size of the baby boom is heading into its advanced years, it's something society needs to plan for. How prepared is Ontario for this boomer bulge? Joining us now in the nation's capital to consider that, Doug Norris, he's Chief Demographer at Environics Analytics. Louis Theriault, Vice President of Industry, Strategy and Public Policy at the Conference Board of Canada. And via Skype, Linda Duxbury, Professor of Management and Strategy at Carleton University's Sprott School of Business, and we are delighted to welcome the three of you onto TVO tonight. Let us just put some numbers out here to get our conversation started, and to that end, Shelton, if you wouldn't mind bringing up this graphic, there are in Canada today 9 million baby boomers. How do we define baby boomers? Well, probably born between 1946 and for some, the end of the 50s, for others, right up to 1964, but you get the drift. There are 3.5 million baby boomers in the province of Ontario alone. Today in Canada, there are 2.7 million seniors who are age 75 and older. And if we look forward, by the year 2040, there will be more than 6 million seniors in the country who are more than 75 years and older. And Doug, as the demographer on the panel, I want you to please start us off by saying, please pick apart those numbers and give us your sense of the implication of those numbers going forward.
Well, certainly those are some pretty large numbers compared to our older population today, essentially a doubling of that older population. And while we're living in better health than our predecessors, living longer, inevitably there comes a time when many of us will need help and support for our everyday living. And I think the challenge we have as a society is to prepare the way so that people can live out their later years in a way that's acceptable to them and also that's affordable for both themselves and society.
Louis, as the guy who knows the economics of the implications of all of this, do you think our society in general and our healthcare system in particular is ready for what's coming?
The healthcare system in Canada is long overdue for an overhaul. We started universal healthcare in the late 50s, in the 60s, it started to spread. We weren't planning and getting organized to take care for so many seniors. So I think we need to rethink some of the fundamental policies that are needed to make sure that our aging population can age in dignity, and we can have a proper support system for that. And right now, home care wasn't part of the design of the universal healthcare system. It's talked a lot about in various provinces. There's home care strategies, and senior strategies for that matter, across Canada at the moment. How we articulate that is the challenge for the future. There are options, but it's clearly currently a challenge. The good news is that it's not a tsunami, as some people have mentioned in the past. It's more like a slow-moving glacier. We have a runway, so to speak, to act on this.
A glacier instead of a tsunami. Okay, that's a different metaphor that we're unaccustomed to hearing. We are, of course, going to talk about what life will be like for those seniors during our conversation here. But Linda, I'd like you to weigh in on perhaps the forgotten part of this equation, and that is those who are going to be caring for these increasingly large numbers of elderly people in the country. What do the numbers suggest about what their lives are going to be like in the years ahead?
Well, I found it interesting that the other participants talked about society, and I thought it was interesting they talked about the healthcare system. But I think employers have to start engaging in this as well, because right now about 1 in 3 Canadians are already having challenges balancing work, elder care, and perhaps childcare. And with the demographic changes, so first we've got a couple things. We've got an aging population, but we've also got an undersupply of youth because our birth rate has been declining for many decades now, and many people are going to be in the position of caring for 2, 3, 4 people who are going to live longer. So the data's pretty well unequivocal. This is going to put real challenges on them, caregiving right now, because as it was mentioned by the gentleman from the conference board, we don't have the strategies in place really to look after and support people who are caring for their elderly dependents. So we're seeing stress, depression, again, absenteeism, prescription drug use, all increasing, people retiring early, and that's going to increase dramatically as we move forward.
Doug, let's get a sense if this is in fact a slow-moving iceberg rather than a gray tsunami, as we so often hear. Let's get a sense of how much time we have to get ready for this. When do you think the crunch really hits? How long have we got?
Well, if we look at the oldest population where the caregiving becomes most acute, around the mid-80s or so, that lead baby boomer cohort will hit the mid-80s in about another 10 to 12 years. So certainly the older population has been increasing at a good rate. It's going to continue that way for the next decade, actually slowing down just a little bit for that oldest 85 and over population. And then in and around 2030, it's really going to increase very, very rapidly for a decade or so. So we have a little bit of time, but we can't be complacent because the numbers are still going to be going up at a pretty good clip over the next decade.
Louis, of course, you saw in last week's Ontario budget, there were some measures announced that related directly to what we're talking about here tonight. $1 billion for a healthy home program for seniors, home and community care to increase, nursing and therapy visits, up to $750 on average per senior per year to have someone come shovel the snow, that kind of stuff. OHIP Plus, the prescription drug plan, not just for 25s, under 25s now, being expanded to seniors as well. What did you think of those measures when you heard about them?
It's well intended, but just to put things in perspective, the whole healthcare budget in Ontario is over $50 billion. So we're at least recognizing the importance of doing something. In terms of the whole scheme of things, is it sufficient? I think it's back to how we spend more wisely that $50 billion, over $50 billion, heading on 60 in fact. So it's more around these fundamental questions, around design. And I think it's the recognition of the importance, but I think what needs to be kept in mind is that there's a fiscal sustainability challenge that we need to keep in mind when we make these announcements. And I can recognize the strategy that the Liberals are pursuing with a return to deficits, but just a few years ago, the $11 billion deficit in Ontario was something we had a hard time seeing as being an issue that could be resolved. It's been resolved. Now going back to that deficit position is a hard place to be in, and you can't plan for long-term deficits like this, particularly in a context where the labor force is aging. And that means a lower fiscal capacity down the road. So the potential for the Ontario economy to grow around 3% is history now. Like we're more talking around 2% a year, which has a direct impact, as I just mentioned, on the fiscal capacity of the government to fund, whether it's healthcare, education, infrastructure, et cetera. So we need to be careful with deficits plans that are for the long run, and particularly when we know something is important around how do we get organized to care for seniors, how these numbers that we talked about in the budget, how they can actually make a significant and what I would call a more system impact, and I don't think we're there yet.
Linda, what was your reaction to the budgetary measures announced by the Liberals last week?
So don't forget, my focus is on caregivers, not the care recipients. And I guess me and the 1 in 3 people who are already in that boat are kind of tired of the initiatives that are focused on the care recipient. This is great, but the rhetoric is we want our aging population to live out their final days in their home, which is lovely, and that's what many of our elders would like. But the problem is that increases the stress and strain on their children and their in-laws and their neighbors who were concerned. Meals on Wheels is great, but if your mother won't let them in the house or says they're fine, the caring doesn't go away on the care recipients. So we're not really doing anything to relieve their stress, their strain, etc. And I noticed nobody's even talked about the whole issue of dementia, which is going to increase problems astronomically in terms of all of these strategies are great if people have mental capacity to be able to deal with them. But if they don't, then what are we going to do?
Doug, I suspect we all know the answer to this question, but let's put it on the record anyway. Does caring for the elderly affect women more than men?
Well, certainly women do a lot of the caregiving, much of it for their husbands or partners. There are many more older women. Women outlive men, and certainly they carry a good part of the caregiving burden, although men certainly do a fair amount as well.
Is that true? Because, I do remember, for example, having the former mayor of Toronto, David Crombie, on this program a few years ago on the occasion of his 80th birthday. And, he was going through a tough time. His son had just died, and his wife was suffering from dementia. And I remember him very clearly saying, "Thank God for daughters." And the inference I drew from that was that women are doing much of the legwork, most of the legwork out there.
No, I certainly would agree with that.
Okay. Louis, let me ask you to just sort of follow up on the answer you gave before, which is, I take your point. We're spending north of $60 billion a year on healthcare in Ontario right now, and I appreciate your concerns about going back into deficit for the next 7 years, as the current government of Ontario projects. How do we make sure we spend smart as opposed to spending a lot to deal with all of these issues?
Yeah. This is the fundamental question. In fact, Canada is a high spender when it gets to healthcare per capita. We're among the highest spenders in the world, in the OECD world, and then when we compare to other rich Western European countries, if we exclude the United States, which is a league of its own and when it gets to healthcare spending, but more France, the UK, Germany, Scandinavian countries, we're spending more, and in terms of outcomes, in terms of access, we're getting less. So that begs the question: how do we spend that extra dollar that we're putting in the healthcare system? So it gets back to something that's a little more strategic in nature. And at the conference board, we have an initiative called the Canadian Alliance for Sustainable Healthcare. That's been 6 years of research on that theme, and how we get organized, how do we have a support system for caring for an aging population, and how that meshes with the fiscal pressure that we see emerging is the big question. So I think we're talking about redesign, and I've mentioned that in my first comment. And I think we need to be prepared to think about a fundamental redesign on how what we want in terms of a healthcare system, what it includes, and who pays for that. And there's different models. Again, those Western and really more the Scandinavian countries that are often used as a model.
Okay, well, let me jump in here for a second, Louis. Give us one example of how you could redesign something away from the way it works today into a way that's smarter for tomorrow.
Well, right now we spend 70% of the healthcare spending is public and 30% is private. That's really unique in the way we do it in Canada. That 30% is paid entirely out of pocket or insurers, and the 70% is paid by governments. In other words, you're in the hospitals, it's paid for. If you're not in a hospital, chances are you're going to have to pay out of your own pocket or from a private insurers. If you compare to these countries that we like to take example on, and let's take Sweden, for example, it's about 80-20. 80% is public, 20% is private. The uniqueness of the system is that it's 80% across the board, so it includes drugs, dentists, physiotherapy, home care. Same thing applies for France and Germany. So these are models that have been structured with a different sense of what home care is and what is healthcare overall. So I think this is the kind of questioning we need to have here in Canada, and we're not quite there yet. The proper diagnosis have been made. We know we're spending a lot by international standards. Just a few years ago, we didn't know that. And for subpar, I would say, outcomes and when it gets to access, et cetera. So I think we're getting there. And the pressure of taking care of an aging population, in fact, is forcing us to have these hard conversations. So it's, in a sense, we have, as I mentioned, a runway to act, and now is the time. We don't have a lot of time, but we have some time, and there's some solutions.
Okay, Linda, I'd like you to weigh in, if you would, on how, in your view, the tax system treats differently things like childcare, things like saving for education, RESPs, for example, versus elder care. What's the difference?
So, I've been doing research on work-life balance and stress for several decades now, and I focused on the childcare end at the beginning. And now a lot of my stuff, as the demographics change, we're finding that, in fact, elder care is the new childcare. However, at the public policy perspective, it hasn't been recognized as such. So we're seeing every budget give treats to parents. And I'm not begrudging that. Those are all wonderful, daycare, etc. But at the end of life, people are doing as much work and sometimes a lot more emotional work to care for their parents, yet they're paying out of pocket for that. So people get time off work, they get money, etc. But when it comes to caring for their parents, there's nothing. It comes out of their pocket. As Louis was saying, if they're not in hospital, you're going to be paying. You're going to be driving. You're going to be a taxi service. You're going to be trying to find care, which is not readily apparent. So, I've interviewed several hundred elder care providers in Canada who are also working. And the number one thing they say is, we don't begrudge parents having it, but we think we should get tax breaks as well. If we are looking after our parents, and because we're looking after our parents, they're not going into the hospital and incurring huge costs, but we are incurring costs, and we would like that to be recognized concretely in terms of tax breaks.
Yeah, clearly there's a savings to society if seniors are able to stay in their own homes longer and be cared for by members of their family or neighbors or whatever. Can you give me a sense about what kind of recognition in the tax code you think that ought to encourage?
Well, I would turn that over to Louis, who's the expert in that, but I would say it's open for discussion. I think it absolutely needs to be discussed because we want, and our elderly parents want to stay home. But let's not make it so that the group who's caring for them, and often caring because they love their parents and want to care, but let's not make it so that they also experience deteriorating health because they care.
Okay, fair enough. Fair enough, but let me get Louis, before I get you to follow up on that and answer that question, let's keep in mind here that on the one hand, I'm hearing we want some kind of financial recognition for the savings to society by us doing our jobs and taking care of our elderly parents or relatives or whatever. But Louis, I also hear you on the other hand saying, we got to watch out that we don't let the budgeting and deficits, skyrocket. Can you do both?
Well, the good news is we're spending already a lot on healthcare. I think, and back to that design issue, I think we need to have that conversation. I've given a few examples of countries where they've designed in a totally different manner. There's a role, I think, in all of this for technology, and we haven't talked about it yet, but Japan, for example, of all the large developed economies, is the fastest aging. And I think there's a few lessons that we can take from Japan's healthcare model and the role technology has played and helped sustain and help care for an aging population. And we have talked about the labor force aging as well and the slower pace of growth in the labor force. We've talked about the volunteers that we rely on. In fact, in healthcare, it's 10 to 1. So it's a really big number. So as all these people age, it begs the question, how are we going to provide the volume of care needed, notwithstanding how we pay for it? And I think that the labor component, which is the provider side of the component and all of this is central. And how we leverage technology is really, really important. Japan is a case in point. They're doing that really well. There are promising areas in the digital health, how we structure our healthcare system and leverage personal medical records, leveraging the advanced technology, the portable technologies, and how the digitalization of the healthcare information, so the providers are acting more strategically when in need, when the patient is in need. I think all that plays a really critical role and making the system most sustainable, not just for seniors, but for the general population overall. So I think in all of this, that's where the solution lies in the end.
Let me jump in here.
We have a labor force issue that we need to tackle.
Yeah, forgive me, we just got a few minutes left here, and I want to get Doug on this as well. Doug, I mean, one of the things Louis is referring to there, Doug, is the fact that robotics are starting to play an increasingly significant role in elder care in places like Japan. Can you imagine that happening here in Canada?
Certainly, I think it has a role, and I think technology is an important component of how we need to address this issue. We're a little bit slower perhaps here in Canada, but we've got a lot to learn from Japan and other countries that are much older today. And certainly, I don't think it'll be too long before we see robotics, for example, in nursing homes, helping with lifting patients, perhaps in meal serving and things like that, which can, in the long run, reduce costs.
Linda, could that be a solution to your fatiguing of caregivers that you're so concerned about?
You still need the human element because they're your parents. They're your parents. You want to be there for them. And so I think many people would like the robotics to help lift, etc. But elder care is part of the heart. And so how do you replace the heart with robotics? You know, I think it's something to talk about, and I think it would be useful as an assist. But then the question becomes, who's going to support robotics in the home for caregivers who want to do that for their parents? And you're still not going to take away from the fact that you're going to need the children who are growing up today to be there to care for their parents.
Okay, we're down to our last couple of minutes here, and I want to read something that was in the Walrus magazine. This is a piece written by a woman named Sharon Butala, who's 77 years old. And here's what she had to write. Everyone around me either ignores old people or treats this demographic as a problem to be solved, thinking in terms of pensions and income levels, healthcare and housing needs, and recently, loneliness, rather than as a resource from which the benefits of thoughtful, experience-based advice might flow. That's really a very touching comment. And Louis, I wonder if I could get you to weigh in on that. Is she onto something there?
Totally. I think what we've talked about largely is around the support system, the machinery that's needed to support an aging population. But I think the real question is around how do we have a society that age with dignity is the central question. And it gets to some of the social norms that we need to reflect on. So we can redesign as much as we want, but nothing will replace how we treat seniors and our aging population with the dignity that they all deserve.
Doug, do we run the risk of being so overwhelmed by the demographics, by the numbers, by the dollar signs that we kind of forget that, these are our parents, our grandparents?
Well, I think certainly Linda pointed that out, and I couldn't agree more. It really is important to keep that human element in, and many of us going through that today with our parents. But I'm optimistic. We've seen governments starting to change. It's been a long time coming. So far, I think they're only announcements, and we'll have to monitor closely. And seniors themselves, those boomers are different from their parents, and they're going to be very demanding. They're a big voting bloc, and I think they're going to make sure that changes do occur.
Gotcha. That's our time, friends. Thanks so much for joining us on TVO tonight. Doug Norris, the demographer from Environics Analytics, Louis Theriault, the economist from the Conference Board of Canada, Linda Duxbury from the Sprott School of Business at Carleton University. We thank you for informing us about this coming iceberg as opposed to tsunami. Thanks, everybody.
Thank you.
My pleasure.
Thanks, Steve.
The Agenda with Steve Bacon is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.